The disease we're looking at today is Méniere's disease. It actually was first diagnosed by a French physician. It is a condition of the inner ear. It's long term, it generally affects one ear and one ear only. Unfortunately, it's unknown as far as the cause of it. So there isn't a lot of things that you can do. There is no cure for it at all. There are several treatments and supplements that you can try, but there is no cure. But what happens with it is there's a fluid buildup in the inner ear that increases the pressure inside the ear, causing ringing in the ears, dizziness. It can cause nausea and vomiting because of the increased pressure, as well as a feeling of fullness within the ear too. And with the dizziness, especially in the elderly, you can see problems with falling. So it can be very serious as we get older. The other thing that you can see is a loss of hearing. It's not necessarily a permanent loss, it's just a loss as the fluid is built up within the ear. As far as who can be prone to it, it really can start at any age, but predominantly it's seen from 40 to 60 years old. However, I personally had a patient just this week that was diagnosed with it that is in her early 80s, so it can be anywhere across the board. Symptoms can come and go. They can be worse at certain times and better at other times. It has to do a lot with what's going on in your life, as well as the barometer, as well as what you're eating too. So it's kind of weird how your inner ear can affect whole areas of your body, but it sure can. So what are some things that we can do because there is no cure? Well, first off, to treat some of the symptoms, the dizziness can be treated with things like Dramamine, Meclizine, or even the motion pressure point bracelets that you can get. As far as nausea, again, that can be treated with those pressure point bracelets or drugs like ondansetron. If you have it long term and it doesn't go away, you can look at doing something like vitamin B6, 100 milligrams on a daily basis. That will help it out as well. Some of the treatments that they do medically, you can use get steroid shots to the ear, which decreases the inflammation in the ear, but you have to do those periodically. And they really, success-wise, it's very mixed boat as far as if you're going to get success with that or not. Diuretics, you can take drugs like furosemide, which is Lasix, bumetanide, which is Bumex, hydrochlorothiazide, to decrease the amount of fluid. But the issue with that is it's decreasing your total body fluid, not just necessarily what's in the ear. So really you could be doing more harm than good with that. You can also do vestibular rehab exercises. And what that really is, you go to a physical therapist or an occupational therapist, and they work with you to improve your stability and your balance. So yes, you might be a little bit dizzy, but this is what we can do to work with that so you don't fall down and you don't put yourself in harm's way. So that is something that you can do. You also can decrease your caffeine and sodium intake because both of those will create more fluid. Your body will retain more fluid if you have a high caffeine and high sodium diet. So you want to decrease that. You also want to cut out tobacco and alcohol. The reason for that is those two products or groups of products decrease your circulation, and you want to have your circulation going as best possible to remove some of that fluid within the ear. You also want to decrease your sugar and processed food intake. The reason behind that, when you eat a diet high in sugar and processed foods, it increases the inflammation. Well, increasing your inflammation can cause problems with your inner ear. You also want to avoid aspirin and nonsteroidal anti-inflammatory drugs, so like Aleve, which is naproxen, ibuprofen, which is Motrin, diclofenac, which is prescription, meloxicam is a prescription, because all of those can make you prone to getting the ringing in the ears. So you want to stay away from those. And you can take an omega, a good omega, because what that does is it does two things. It decreases inflammation and increases circulation, which may help you out. And as a final thing that you can look at, you can do surgery to have your inner ear actually worked on. It is a last option out there, but there has been some good success for those kind of people that where it's just misery as far as the dizziness and the ringing in the ears and pain as well. The good thing about it is as you get older, it tends to lessen the symptoms. So if you can stick it out, it may get better. However, remember, I just said I had a patient in her early 80s just diagnosed with it this week. But hopefully those are some tips that will help you out.